Local school districts are working to ensure the safety of students, with Tennessee confirming its first measles case.
This is Caitlin Quisenberry looked into how districts across the state plan to respond to the potential for future cases in the classroom. Caitlin.
Well, the highly contagious virus has symptoms of a high fever, cough, runny nose, and red or watery eyes, followed by a rash on the chest, face, or legs. With over 300 cases and 2 deaths in 19 states, if another case pops up, doctors say the state and CDC have a plan for how school districts should respond. If a case is suspected in a school, the sick student or staff member will wear a face mask and be placed in a private room before being sent home. That room would then be disinfected after 2 hours. The school would be required to review immunization records of all students and send out letters to parents with information on isolation, exposure, and medical care. Students and staff with current or past immunizations within 72 hours of exposure can return to school. Otherwise, they must stay home for about 21 days if exposed. Any patients with measles should stay home for 4 days after their rash appears. A doctor with Vanderbilt University Medical Center tells me this virus is unlike any other childhood virus. He says 1 out of every 5 little kids who get measles have to be hospitalized.
And it might make sense for them to not come to school if they have any respiratory infections or any rash symptoms, of course. And the last is that we want to make sure that we're cleaning things carefully. Measles is one of the most contagious viruses that we have, and it can live in the environment for at least a few hours after a case walks into a room. So we're going to be teaching our schools and our nurses how to clean those rooms effectively while also protecting ourselves.
I reached out to Middle Tennessee's largest school districts, Metro Nashville, Wilson, Williamson, Clarksville, Montgomery, and Rutherford County school districts, all telling me they would work with the health department and follow its guidance. Bob.